In this video, I'm going to talk about what is the role of the mock-up in veneer procedures. Why do I need to place a mock-up? Okay. Mock-ups are what? Are a trial of the aesthetics. You're trying the aesthetics before you do your final procedure. I do it over, what guides my mock-up? How does it become guided? How much I'm going to do?
wax up.
إذا في عندي wax up. الguide الwax up. Any other material could be? Okay. So wax up. Okay, let's just to capture the sequence. عندك wax up. So it's manually done. It could be based on smile design. Because in smile design, you'll get the dimensions of the teeth and the gold standard and whatever. Okay? So from a smile design, you know the dimensions of the tooth. So you send it to the lab, they will do your wax up. Or you do the wax up as a prosthodontist, you should do this procedure. Then after wax up, index. So you're going to do the mock-up index. How much material? Light body and putty. You do your index. Okay? Index. Then cut the index. How do we cut the index?
1 millimeter.
1 millimeter above the margin of gingiva with slots, escape slots to allow the material to come off. Then
we add the material.
In the clinic, we add material. What is our material? Temporary acrylic. It's not composite.
Yes.
Temporary acrylic. Okay. So this is our first mock-up. Can we use as a mock-up? Can we use temporary crowns as a mock-up? Temporary veneers, sorry. Can be our mock-ups.
Should temporary veneer?
Temporary veneers that I'm placing. So I do minimal preparation. Minimal preparation. I place temporary veneers. I shape them clinically. So these are clinically driven, not from a wax-up. These are clinical.
temporary veneer مصنوع من إيش؟
Composite.
Okay.
Okay. I can do it if I'm in a hurry. I don't have a wax up and so on. So I place my these are like temporary composites. Okay. Temporary. These are veneers out of composite made for temporary reasons. I shape manually the teeth. Okay. And then I do my clinical preparation over these veneers, composite veneers. So they also serve me as a mock-up. But what is the mock-up in our preparation? What is the role of mock-up in our preparation? It's not only to guide aesthetics. So first reason why we do mock-up is trial of aesthetics, huh? Aesthetics, trial. So I try the shape, the shade. Sometimes if I have a lot of different shades of my temporary material, temporary acrylic, I could also I try the shade, I try the morphology, if the patient is satisfied, and so on. So I try all of these. But there is another benefit of mock-up is what? Guiding my preparation. Guiding a prep that is conservative. This is what I'm aiming at.
هذا من البريب اندكس.
No, it's from the mock-up. Why? Because from the mock-up, suppose I have tilted teeth. Pig shape. Pig shaped, maybe lateral with broken margin. So not all of them. When I made my best wax up that I had, this is the best wax up for them. Looking from them incisally, okay, from the incisal edge. Okay, this is my best morphology that I got. So I don't need to cut all of this enamel. Equally. So with the mock-up over the teeth, I do my preparation slots. Remember the slots over the mock-up. So maybe I will need only to cut this amount from this tooth, maybe only here from this tooth, maybe all of this tooth. Depends on how much close or back it is from the wax up we created, the correct wax up. So this will preserve and conserve the tooth.
دكتورة ما تقدر تعملي عملي يعني هون.
Okay, I'll show you. I'll bring you. I don't want to waste your time. This is the time you're going to be working. The idea is a lot of videos are present. Extremely huge array of material on the YouTube is there. I'll try to find you the link. And if you find a beautiful link, just put it in the comments. I'll just put it in as I'll pin it as important comment, and it will always be on the top. Okay, so it's guiding prep during through the mock-up. Okay, so it will be conservative tooth preparation. I do not need to prepare all of the enamel. Leave a lot of enamel. But once more, go back to the video we talked about enamel not prepared. It should be at least scratched away to remove the fluoride-rich layer. What else will guide? What is another benefit of mock-up? It will guide surgeries. Okay? If I need to do gingival marginal morphology of the gingiva and procedures, it could be soft tissue or bone procedures. Okay, so the mock-up with the wax-up will guide the surgery. Where are the ends of my surgery? I could, and over my mock-up, over the mock-up. So I have done the mock-up, and over the mock-up, I produce a surgical guide. This is before this. It's a surgical guide over the mock-up. It will tell me where are the margins of my teeth and where are the margins of the bone, because how much bone, how much away from the bone should I have my margin, my preparation margin, to preserve the supracrystal fibrous tissue that was previously called biological width.
2.04.
2 in the least 3, 2 in the molars, 3 in the anterior. So it will guide not only the gingival morphology of the surgery. If I'm going to do gingivoplasty, it also guides the bone position as well. The bone should always be away from the finish line that I'm aiming at. Okay, so it will guide my surgery. It helped me. Over it, I make my guide. What also could it tell me? It also guides my contact area shape. Guide my contact area morphology. Why? Because I want to create an interdental papilla. Okay, and we want the interdental papilla to go in between my restorations. So these are the teeth. They have a zigzag shape. Okay, and the gingiva comes in between. What determines that the gingiva papilla covers the embrasure, the gingival embrasure of teeth? It should have the difference from the bone. How much is this distance? It should have vertical distance from the bone. How much is this distance? There was some study that talked about this. So it said if you have a 4 millimeter distance between the contact area and the crystal bone, you will have at least around 100% coverage. If you have 5 millimeters, you will have 90% coverage. Okay, and there are other studies. Whenever it's less, you will have. There is a chance, but a very low chance. It's not predictable. It becomes not predictable. So this is why in some textbooks you will find that they use usually the 5 millimeter issue, but also taking into account the quality of the bone and having a good biotype. Okay, thin biotypes don't cover this. So the mock-up will guide the position of contact areas. Okay, of your restorations. Where am I going to place the contact in comparison with the soft tissue and the bone? Okay. What are other purposes of our mock-up?